Hi, I'm Ariel FRIESE with Akasha Counseling, and welcome to the Counselor Chronicles. Today I'm so excited to have Asher Ina with us. Asher, thank you so much for being here.
Thank you for asking me to do this.
Yes. So Asher is the owner of Infinite Possibilities Counseling in Denver, and Asher is here to talk about how to best support an individual in your life who is transgender or gender non-conforming. And Asher has a number of tips for us today. We'll start off by just acknowledging that I'm saying Asher a lot rather than a pronoun, and something Asher and I have talked about is how it's best to ask what are your preferred pronouns.
Yeah.
So maybe you can start us off by talking a little bit about that.
Absolutely. I think that the idea of asking pronouns for folks that aren't, who identify as cisgender, right, and aren't a member of trans or gender nonconforming communities, I often hear so many times how nervous they are. Like, how do I ask this? I'm going to botch it. I'm like, I feel so much more seen and respected when anyone just says, hey, what are your preferred pronouns? It's like, it just automatically, I feel safer with that person. So my advice is, first tip, right, ask pronouns, preferred pronouns, and always use their chosen name. And so, just to really show them, I see you, I respect you, those sorts of things. And so for me personally, thank you for asking, I use rotating pronouns. He, she, they, you can rotate between them all. I kind of go with an all of the above model, those sorts of things. And so.
Perfect. Yeah. That's a really great tip, and I think allows people to feel more comfortable in just asking that question.
Yes, absolutely. So, I think that, and on that first tip too of like pronouns, chosen names, don't be afraid to ask, obviously if somebody introduces themselves, that's probably their chosen name anyway. As I was sharing with you just a little bit before we started taping, Asher is not my legal name. It is actually my chosen name. So again, there's people in my life who have always known me, or who would only know me, like you, right, as Asher. And there's people who know me as both my name from before and now. And so it's just, using Asher, though, is definitely something that's preferred because people, still sometimes from my past use my birth name, and it just is like, kind of like a dagger. So,
right. It's not as comfortable for you.
Absolutely. Yeah.
Great.
Yeah.
What's your next tip?
My next tip would be, while, folks are questioning their gender and really just, whether it be questioning or just going through this idea of exploration, because it's kind of a long journey for all of us. Typically people have been thinking, something's up, I know something's off with my gender, but I'm not sure what before they even walk into my office. And so my job is to really help them explore that. But part of that is what pronouns, right? What is their chosen, what do they even want their chosen name to be?
Right.
So, which can be really complex because we're all used to being named.
Right.
Coming up with your own name is a whole different animal.
Yeah.
Super easy for some people, really hard for others. And sometimes we'll work for sessions just on, does this name feel right? Nope. This one? Nope. You know what I mean?
Wow.
So while you're supporting your loved one, you might have them go through periods where they insist on certain pronouns, or let's try this name out, and then it might switch again, and it might switch again, and so just really being patient and understanding, like, it doesn't mean something's wrong with any of us. It means we're trying to really feel comfortable in our own skin.
Yeah.
Like, even myself, like, again, I haven't changed my name legally yet. Some of that is laziness, but some of it is also because I wanted to make sure that Asher really stuck. It felt right when I was being called that, when I was introducing myself.
Right.
Because that's a lot of part of this that a lot of people don't think about is, okay, it's different for you all now. You've been calling us one thing for a long time, and now we're asking you to switch. Same for us.
Right.
Like the first time I introduced myself as Asher, it was like, wait, what did I just say?
Right.
And so this isn't easy either. Even like a year ago, and I've been Asher now for like 5 years, I was at Starbucks and gave them my birth name, and then I was like, how did that just happen? And so we trip up too. We'll understand, that you all trip up, and that kind of brings me to my third point of, as long as you're trying, like, I always really respect folks who are at least trying.
Yeah.
If they kind of get the pronoun wrong the first time, and then, or the name, and then it's like, it's like, I don't go over the top and make a big deal out of it, because then all of a sudden we're all uncomfortable, and I'm now comforting you, and I'm not comfortable either, but like, even just a simple, sorry, try again, correct it in the moment. Because again, and this is what I even work with so many of my clients on when they're transitioning, or the families, is like, I might have been thinking about this transition for the last 10 years, but you just kind of got blindsided when I told you. So some of us get angry for a while when people, you know, kind of butcher the pronouns and stuff like that, which is understandable, but I think that there should be a lot more leeway, you know, when I work with my trans clients and my gender non-conforming clients, to be like, listen, we need to be a little bit patient as long as they're trying.
Yeah.
So it's really just about respect both ways.
Yeah, that makes a lot of sense. That's helpful.
Yeah. So that's sort of the second one. And then I think bringing us to the fourth point is there's really no right or wrong way to transition. I think that's a kind of it's something that, you know, we used to see. People would just switch from one binary, like male to female, or the other way around and stay very much in the binary system.
Yeah.
Well, there's a lot of us now who don't.
Right.
Like myself included. I just identify as I'm just non-binary. I just kind of fit in both and none at the same time, and just I'm always sort of like, can I just be myself?
Right.
You know, can I just be Asher? So, you know, I think that keeping in mind there just really are no right or wrong ways. You know, the standards of care that we used to use to write all the letters for hormones and surgeries, which have become much more lenient, which I'm really happy about.
Yeah.
Because I don't want to be anybody's gatekeeper, and I don't want to have anybody prove to me, like, this is real, this is what, you know, it's like, you're the expert on your own life, is what I always tell my clients. I'm just here to make sure you're ready for sort of all of the systems in your life to know, to, you know, and are you ready to really, are you just informed of what's going to be coming up?
Yeah.
But some people will choose surgery, some people will choose hormones, some people will go with neither, sometimes both, you know, and well, this brings me to a topic later, but people often ask me, like, are you on hormones? Do you, you know, do you take surgery, or have had surgery? And I'm like, no. And at the same time, those are very invasive questions. So I'll save the rest of that for another point. But we all get to do this differently and what feels best to us.
Yeah.
And I think that, you know, that's just kind of an amazing way of it's just expression.
Yeah. I could see how it could be challenging coming from a society and culture where people kind of need to know, or black and white, yes or no, and then, you know, how do you identify I need to have an answer, and that can be, I imagine, challenging for people kind of carrying that with them too.
Absolutely. Like, you know, it's like when we kind of get the message, right, being somebody who's non-binary, I've known this since I was 2 years old, but I didn't have the language for it, you know, just generationally I did not have this language that all of, you know, a lot of people have now, so it was just really confusing. Yeah. And it does, you carry with you the sense of, I don't belong. Even in something as simple as my gender, I don't belong. And so it does. It takes a toll on self-esteem and those sort of pieces. Comes with a lot of shame. Obviously, religion and, you know, different societal values play a lot into this. And so I spend a lot of time with my clients and their families or their spouses unpacking all of that and really helping them see, like, it's also beautiful. You get to be exactly as you are. And then, of course, we have to deal with ramifications that may or may not come with that, which are unfortunate.
Right.
Yeah.
Right.
And beautiful.
Yeah.
So,
that's so great.
Yeah, so I think that's, and leading us into the next point is kind of on this idea of it not being a right or a wrong way. There's also, don't expect us to conform to gender stereotypes, right? Just because somebody might say, like, my gender identity is male, that does not mean they have to fit into society's, you know, this Western view of what it is to be a man. Yeah. You know, and not only do they put that pressure on themselves a lot of times, and then again, it's that message of what's wrong with me. But then I also watch a lot of parents start questioning their, you know, especially their teenagers. Yeah. Of like, but you still like to wear makeup, but you say you're male? Yes, you can still like both. Right. And all of the above. And so, you know, it is like really, again, pigeonholing into those binary systems can be really problematic.
Yeah, I could see how people could just naturally do that and not know that might be really confusing for someone.
Yeah, and really hurtful.
Right.
Yeah. Yeah. Yeah, because nobody wants to have their expression of self oppressed in any way. Right. Yeah. Absolutely. So, yeah, that's kind of that next point. And then I think also, let's see, I'm reading clearly over here, right? I have to cheat a little. It's all memorized, but it needs to flow a little bit. But I would say, don't forget, it is okay to ask questions about somebody's gender identity. Like, my experience is going to be much different than somebody else who identifies as non-binary. You know, it's like, what is it about that to you? What matters? What do you want me to know about your experience? Right. I think those are lovely, lovely questions. And it just helps to be seen if those are asked.
Yeah.
You know, and again, how do I honor somebody for who they are?
Right.
But then comes to my next point of certain questions not to ask. There are some that are also very damaging. You know, I don't need to be asked about what my genitals are. None of us do. I wouldn't ask you, so let's not ask me, right? Again, have I had surgery? Do I want surgery? Those can be very invasive, you know. If you're close enough to someone, that's a different conversation, but, you know, just to ask any sort of person you meet off the street that, it's a very invasive question, as well as how they have sex. Again, back to the genitals, like, you know, if you're dating this person, these might be questions you need to know.
Right.
If you're just hanging out, like, I don't really need to know how you have sex.
Right.
Right? So we're good.
Right.
You know, so why would you ask me something? You know what I mean? Just out of curiosity. It's kind of greedy and selfish.
Right.
So really, you know, having kind of checked that, there's a lot of places you can educate yourself if you want to know that, but try not to ask the person directly. Yeah. And also asking them what their legal birth name is can also be really damaging. Like, I don't necessarily care telling people, but it's always kind of like, why do you want to know? Right. You know, like,
what's the intention behind that?
What's the intention behind it? Absolutely, because, you know, some people will still refer to me, by my birth name, I don't mind sharing, is Elizabeth. I went by Liz for the majority of my life, so some people still refer to me in my past as when I was Liz. But that's also really damaging, because I've always felt like Asher. Liz never was right. Yeah. It wasn't until later in my life, though, I figured out why. And so I'm still, as a kid, I was still Asher. So maybe even asking people about, like, how do they prefer I reference you in the past? Right. Or saying, like, oh, when you were a girl, also really problematic, right? So I know language is tricky, and it feels like we're picking things apart. But it's really about just being seen. Yeah. That makes a lot of sense. Yeah, so, yeah, please. And then also, please don't tell anyone about somebody else's gender identity, like that idea of outing, right? I kind of hate that word, but that's a different talk. Yeah. But don't ever, you know, tell somebody else without someone's permission. Right. You know, and I think, too, back to if somebody needs to know or even ask those harder questions, like, again, what's the intention? Like, yes, my medical professional needs to know. Right. You know, or my bank needs to know my legal name or something like that. But your everyday person does not need to have that information. Yeah. Do you have suggestions for family members or friends if they were to be asked that question about a loved one, or if something's going on with their gender specifically, or have they had surgery or something like that? Yeah, like you said, like outing their gender. Gotcha. You know, again, I would never just out somebody, and I would never confirm or deny it. I would just say, you know, like, I don't really think that's important for me to speak to in this moment. And, you know, then you can always ask the person that you love, like, how do you want me to address this when people ask? Because for me, I'm obviously out all over, you know, like, my website will say it, everywhere says it, so I don't really care if people out me. So that's always my answer is, tell whoever you want, especially if you can use it as an advocacy or an ally type thing. Now, if you're just gossiping me about me because of my gender, probably steer clear of that. Right. So right. Okay, great. And then I think too, the next one is remembering that I always get asked, like, are gender identity and sexual preference like the same thing? No, they're very different, right? They can influence each other, but, you know, that's always the first question. A lot of my clients come back and they're like, so I told my dad, blah, 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 and now he wants to know if I like boys. You know what I mean? Or something. And it's like, these things are two different concepts. And so, like, just to use myself as an example, growing up, right, again, all of the trans terminology, gender non-conforming terminology just did not exist. So I knew I was a very masculine female who typically dated women. So I was like, I guess I'm a lesbian. It didn't really fit, and I knew that, but I didn't know why, right? But then all of a sudden when I realized my gender isn't female, I can't identify as a lesbian, I still like women, right? But I'm not but I'm not a lesbian. So it changed the term, but it doesn't necessarily change my attraction. Yeah, that makes a lot of sense. Good. So just to remember that, and then lastly, you know, I think educating yourself is, or this isn't lastly at all, there's 3 more. Yeah. But, so on the next point is just educate yourself. You know, I think that, again, asking those questions about my personal identity, I'd love to always answer those, but just trying to be a spokesperson for, even in this moment, right, of all things trans and gender non-conforming, like, educate yourself, read the books. Don't leave it up to us to always do it, because it starts to feel like a really big burden to always educate everyone all the time.
Right.
Yeah.
Maybe after we wrap up, you can give me some names of books or resources or places that folks can check out. That would be helpful.
Absolutely.
Okay.
I'd be happy to. And then also, I would just keep in mind, for those of you who are the loved ones of all of us, right? You're going through your own process. I don't expect you to just be okay with it, especially parents and spouses. Like, you're going to have your own process, your own grief. All of that is totally normal.
Mm-hmm.
And I would just encourage you to seek out support, or I'd encourage them to seek out support, whether through their own therapy. There's a lot of different support groups,
Mm-hmm.
and I can give some of those to you as well to put up with the post. But don't be afraid to, really take care of yourself in all of this. I don't know. It always depends, too, on how much of your connection is close to that person.
Sure.
Because you don't want to lean on the trans or gender non-conforming person to, be comforting you.
Right.
But you want to have an open discussion. So
Right.
it's like a lot of folks, it's like even my mom, reading, what she needed to and these sort of things to better understand. And then coming to me about maybe Asher-specific questions.
Yeah.
Was really nice that she took that on as hers.
Yeah, that's really helpful.
Mm-hmm. Yeah. And I think the last point is just being an advocate and an ally, as all over the media, all the stuff about bathrooms, and bathrooms are a real thing. This is a real stressor for a lot of us,
Yeah.
I get screamed at sometimes when I go to the women's room. What are you doing in here? Oh my God. All of this sort of stuff. And in the men's room, they don't really seem to care at all, which I find fascinating. But for me, it's a safety issue. I can prove to you really quickly, if I have to, that I'm a female, or if the security guard gets called or something like that. But I'm just thrilled that a lot of places now are going to, gender-neutral bathrooms or family restrooms.
Yeah.
Because it is just such a relief to be able to pee in peace.
Right.
Let's just be honest. So I think, being an advocate and an ally for just different causes, or different kind of, things are a struggle for us.
Yeah.
Is always nice, because again, it comes back to that education piece. Like, we cannot fight this battle alone.
Yeah,
So,
absolutely.
Yeah.
Those are some awesome tips.
Thanks.
Thank you, Asher.
Thank you, and thank you for having me.
Absolutely.
For sure.
I'm going to include Asher's contact information, as well as website, and you can check out Asher's information. And I just really appreciate you being here.
Absolutely. Thank you.
Thanks.
Thank you.